Good day, everybody. This is the first of our series of lectures regarding the muscle system, and in this particular lesson we're going to focus on types of movements and identification of some muscle interactions, and we're going to finish up with some easy clues here for learning how to name muscles. With here just some ordinary body movements that you might encounter. One is flexion. Okay, flexion would be any kind of movement here within the sagittal plane that is going to decrease the joint angle, or in other words, bring two bones together. So if you're looking at this picture here, starting in an anatomical position, which the arm would be down like this, okay, and moving it forward, okay, that is flexion. You could also do the same thing if you're going at the elbow here and bringing the forearm up, that would be flexion. Or as is better shown right here in the knee, you're bringing these two bones closer together, or you're decreasing the joint angle. Okay, the opposite of that is extension, which is increasing the joint angle. And extension, again, if you look from anatomical position, being right down like this, okay, anytime you're bringing your arm backwards, or you're straightening your leg, or you're straightening your elbow, you are extending the joint or making the two bones further apart, and therefore increasing the joint angle. Anytime you go beyond 180 degrees, in my example right here, you're pushing your shoulder back, that would be hyperextension. Hyper is a prefix which we use to imply more or greater than. Now, rotation could be shown here in your head and neck, but it could also be done, in your leg. But rotation is basically moving a bone, along that longitudinal axis. Okay, so basically, like you turn your head, left to right, shaking your head no. That'd be an example of rotation. If you take your foot and turn your toes out, that would be lateral rotation. Medial rotation would be bringing your toes in. You could also do the same thing in your head here. Okay, if you look out, okay, that would be lateral rotation. If you look from the side back to the front, that would be medial rotation. So basically, the middle here, or median plane, move your head towards it, medial rotation. Move your foot towards it, medial rotation as well. Move your foot away from it, lateral. Move your head away from it, be lateral rotation as well. Now, the next two types of movements here, abduction. A good way to remember this might be to think about if a child is kidnapped, or we say they are abducted, they are taken away from. Abduction is moving your body away from, or body and limb, away from the midline. You are taking it away from the midline, whereas adduction is the opposite. You think about the first three letters of adduction, ADD, you are adding or bringing the limbs closer together. Okay, so ab, take away, like an abduction of a child, or adduction, bringing things together, adding 2 points together. Now, the third one here that we have on the slide is called circumduction, which is a very special type of movement. In this one, is a combination of both flexion, extension, ab, and adduction. Basically, what you need to remember here is just that the proximal end of the joint, in this case your shoulder joint, is going to remain stationary, while the distal end, in this case your fingers, move in a circle, so that if you were to look at this in 3 dimensions, it would look like a cone. That might help you remember a cone for circumduction. Next couple slides, we're going to deal with some special movements. They don't fit in the other categories. The first one we have here is opposition. Opposition involves taking your thumb and pressing against all 4 of your other fingers. This is allowed because of the special arrangement here of the thumb joint here. The saddle joints of the thumb here allow you to do this. Special to your forearm is supination and pronation. In supination, this is basically anatomical position. Your palm is forward. Many people say that if you were going to try to hold a cup of soup in your hand, take a sip of it, that's like supination. You have to have your palm up. Pronation, opposite here, thumb is going to be medial. So your palm is going to be back. So some people say, like, you're thinking about, hey, do you want some soup? You put your palms up. Or no, push your palms down and push it away. No, I don't want any soup. So pronation, moving away, basically moving your thumb hand back and supination, palm up. Now the other movements here of the feet, first one involves inversion. Inversion is turning your sole towards the middle or medially. As you see in this picture here, it's basically inversion when somebody sprains an ankle because the feet turn in. It can also be done here if you try to walk on the lateral edge of your foot, the outside edge of your foot. Eversion is the opposite. You're going to turn your sole medially, basically trying to walk on the inside of your foot, across your big toe. Still in the ankle, you have some special terms here because of it from anatomical position. Anatomical position is this position right here with your foot flat. If you are going to pull your toe up, like bring your toes towards your shin this direction, that's dorsiflexion. So basically if you stand on your heels, that's dorsiflexion. The opposite, plantar flexion, would be pointing your toes or standing on tippy toe. All right, so from here, this would be like a gymnast or a ballerina, going up on toe. This would be plantar flexion, this would be neutral, and this right here would be dorsiflexion.